Of course, February is Heart Month, and you may not realize this, but every 40 seconds, someone in this country dies from heart disease. The numbers are still staggering. There have been a lot of improvements with heart health over the years, but we want to really focus on what you can do to prevent heart disease. Dr. Brian Wilcox is here from St. Thomas. And nice to see you. Let's start out with the broad topic of heart disease. We know there are many conditions related to heart disease. Can you just sort of paint the picture for us of what heart disease entails?
Yeah, sure.
Briefly.
So the way I explain to my patients often is heart disease is blockages in arteries. So if my cupped hands represent your heart beating, those veins on my hands represent your coronaries on the surface of your heart. And when people say they've had a coronary or they've had heart disease, usually in this country it means they've had a blockage develop in one of those small arteries on the surface of their heart. There are other conditions like valve problems, but most of the time when we speak of heart disease in this country, we're talking about hardening of the arteries or coronary artery disease.
And would you say the majority of the time those blockages lead to an event, a heart attack?
Well, many times they will. Sadly, in this country, people develop coronary disease at a young age. So we know in the coronaries of 20 and 30-year-olds, there's significant disease. So often by the time someone's in their 40s or 50s, those blockages become severe enough, they cause symptoms. And if untreated, those blockages almost always result in an event in their lifetime. Most commonly, chest pain.
Are most of those young people with a lot of the blockages in their arteries, is it genetic factors? Is it what they're eating, their lifestyle?
I think you just finished my talk beautifully because it's all of those. The truth is we can't change who our parents are. So what we're given genetically, we can't do a lot about. But everything else we can control in our environment, what we eat, how we exercise, what our other risk factor behaviors are like diabetes or smoking, all those determinants of heart disease we can manage very well.
Exercise, I see on our list, of course, that we're up on the screen right now, risk factors for heart disease, of course, diabetes, smoking, obesity, poor diet, lack of exercise.
Sure.
Exercise can actually increase the good cholesterol. That's good news, right?
Absolutely. So to your earlier point, there are a lot of things we can do to reduce our hardening of the arteries or heart disease. You can exercise. As you exercise, that cholesterol will actually drop and the good and bad cholesterol ratios will improve. It'll decrease the percentage or the rate with which you develop percentage blockages in your heart, and your general fitness, your heart health improves with regular exercise. There's so many things we can do to reduce our risk of heart disease. So that regular exercise program, when combined with the right diet, that activity level, the right medications, the right other behaviors, no smoking is essential. All those things add up to reducing your risk of heart disease or controlling the rate with which it progresses. How
about reducing stress? That's one of those more abstract things, hard to quantify.
It is.
But it is critical, isn't it, in managing?
It is important. I would say it's probably overstated by a lot of patients. Everybody believes their life is stressful, and it is. But the stress that results in heart disease is a little different than just day-to-day stress. It's the stress like somebody stuck you with a needle. That's the stress that can cause really accelerated heart rate and blood pressure, which over a sustained period of time results in heart disease. But stressful lifestyles, to your point, over time will result in an increased risk of heart disease for sure.
Speaking of blood pressure, there were new guidelines, I understand, that were released last fall. Educate us on those.
Well, the American Heart Association guidelines for blood pressure we need to pay attention to have changed. So 120 over 80 are the new numbers. So if the upper number is higher than 120, then we need to start to pay attention. And if it's over 130, we need to treat that number. If the lower number or diastolic number is 80 or lower, we're okay. But if it's over 80, then it needs to be treated. So again, if your blood pressure is in that range or higher, then you need to see your healthcare provider.
What are the signs and symptoms of a heart attack? Is it, the crushing chest pain? It seems like usually with men you hear about chest pain or feeling upset stomach. That feeling with women, it seems that the symptoms are different. Let's go over those symptoms.
Sure. So for men, it's a more classic symptoms that we think about, and unfortunately that's kind of minimized the attention we pay to women sometimes who have symptoms. For men, that classic heaviness, that elephant standing on your chest with radiation pain to your neck or your arm is often seen. Sometimes shortness of breath or sweating when that happens. With women, the signs are a little more subtle sometimes. Fatigue is actually a really common symptom that women with heart disease describe. Sometimes just nausea or lack of energy or exertion. Sometimes sweating can be an indication of heart disease. So for women, paying particular attention to when they don't feel well and they have the appropriate risk factors can uncover heart disease.
Are there some tests that we ought to consider having or asking our physicians about getting, screenings for heart disease that will really give us a window besides an EKG? Are there some other scans or things that you would recommend?
Honestly, we start with just a good history and physical. So talking to somebody and saying, what's your family history? Who in your family had heart disease and how did it, at what age, materialize? And then talking to somebody about symptoms they might have with exercise or without exercise, that's a great starting point. Then there's, to your point, the EKG can be done, but then there's some blood tests around cholesterol or lipid status, which can predict heart disease. Those are early starting tests. And then when your provider has an idea of concern, then they order more sophisticated and expensive, but very helpful tests.
Is there a test that will tell you your calcium score that's important too? I might be going too far down the path, like once you've been diagnosed and then you want to explore further, but I keep hearing about the calcium scores.
Sure. The nice thing about calcium scoring is it's often done with a CT scanner and it's pretty easily obtained. But again, that information, when you have it, needs to be interpreted very wisely. And usually that's done with kind of your heart care professional, like a cardiologist. So as a screening tool, probably not the first choice, but it's one of the tools that any good provider has in their toolbox that they can think about when they talk to patients.
One last quick question. Where can I find out, where can our audience find out more information? What's a good resource?
So two places I go to regularly and refer patients. The American Heart Association website and then the St. Thomas Health website has connections and links to all kinds of helpful things like Chest Pain Network, risk factors, and where you can go for treatment.
Great. Okay. Thank you so much. Happy Heart Health Month.
Oh, we hope to. Thank you.
Thanks, Dr. Wilcox.
You bet.
We'll be right back after this.